What happens if smegma is not cleaned for a long time? Welcome to Prostate Patrol, your trusted channel for men's health. Today, we're addressing an often overlooked but crucial topic: what happens if smegma isn't cleaned for an extended period? Intimate hygiene isn't just about comfort, it's essential for preventing health issues. Stay until the end for practical tips and recommendations. What is smegma, and why does it form? Smegma is a substance made up of dead skin cells, oils, and moisture that accumulates around the head of the penis and under the foreskin in uncircumcised men. While it serves as a natural lubricant, lack of regular cleaning can lead to health problems. Consequences of not cleaning smegma regularly. 1. Bad odor and discomfort. Accumulated smegma produces a strong, unpleasant odor that can impact your confidence and interpersonal relationships. 2. Irritation and redness. Buildup can cause irritation and redness on the glands, leading to discomfort during urination or sexual activity. 3. Balanitis. Prolonged neglect can result in inflammation of the glands, known as balanitis, characterized by pain, swelling, and discharge. 4. Bacterial or fungal infections. The warm, moist environment promotes the growth of bacteria and fungi, increasing the risk of infections. 5. Phimosis. In severe cases, excessive accumulation can harden the foreskin, making it difficult to retract, a condition known as phimosis. 6. Risk of penile cancer. Although rare, chronic smegma buildup has been linked to an increased risk of developing penile cancer. How to prevent smegma buildup ****. 1. Hygiene. Wash your penis daily with warm water and mild soap. If uncircumcised, gently retract the foreskin and clean the area underneath. 2. Proper drying. After cleaning, thoroughly dry the area to prevent residual moisture that can encourage bacterial growth. 3. Avoid irritating products. Steer clear of scented soaps or harsh products that might irritate the skin or disrupt its natural balance. 4. Seek medical advice if necessary. If you experience redness, pain, or difficulty retracting the foreskin, consult a healthcare professional promptly. Frequently asked questions. 1. How often should I clean smegma? Daily. This prevents buildup and keeps the area healthy. 2. Is it normal to have smegma even if I clean regularly? A small amount is natural, but visible buildup may indicate inadequate cleaning. 3. Can I use wet wipes? Only in emergencies. Regular showers with warm water and mild soap are more effective. Conclusion. Cleaning smegma regularly is a vital part of male intimate hygiene. Prolonged accumulation can lead to serious issues that affect not only your physical health, but also your quality of life. Adopt a daily hygiene routine and consult a medical professional if you experience any discomfort. If you found this information helpful, give us a like, subscribe, and hit the notification bell for more men's health content here on Prostate Patrol. See you in the next video.